This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, here we go with the medical minute. Today is going to be better than yesterday, that's for sure. All right, a couple shifts ago, I had a fine young gentleman who was assaulted by two dudes, and he had a lot going on. But tooth number 26 was gone. Tooth number 27 was out, and the paramedics brought it with them. So it had been out for a while. So what do we do when there's a tooth that's been out, the patient's just got it in their pocket, it's hanging out? Any general ideas, thoughts? What should we do with that tooth? Throw it away, put it under the pillow. They might get something. Yeah, put it in milk. Okay. So, we have all these sayings, right? Like time is myocardium, and time is brain, and time is testicle, and time is ovary if it's torsed. So time is tooth. You got to get it back in. So in casually talking about this case later with an oral surgery friend, he said that if you don't get that thing back in within 20 or 30 minutes, it has almost no chance of survival. And he said, typically, if he were here, we had oral surgeon ready to be deployed, he would do a fairly complicated process of getting that tooth back in, which would include a gentle scrubbing, soaking it in a fluoride bath, then soaking it in a minocycline bath, then performing a root canal on the tooth outside of the jaw before putting it back in. None of that is available to us. So all we can do is do our best. And remember that we've probably got realistically about an hour to get that tooth back in. So it is true that milk is probably going to be the best transport media for us, and ideally chilled milk. So you could either get cold milk from the fridge or put it in milk and then put that kind of in a bucket of ice so that it's chilled. That's going to preserve. And what we're really looking at preserving here is the periodontal ligament. There are also cultural medias that you can throw it in, but I don't think we have any of those here. There's one specifically called Hank's Balanced Solution, or the trade name is Save-A-Tooth. So if you work someplace that has that, you can put it in there and then kind of work on getting that tooth back in. What happens if you put it in tap water? Bad things. So actually the very sensitive cells of the periodontal ligament will just lyse and die within just a couple minutes if you soak it in tap water. So that's a really bad idea. So what's described in terms of getting the tooth back in is that you should try to disturb the socket as little as possible. Ideally, you would have an oral surgeon put the tooth back in, but generally we don't have an oral surgeon that's quickly available. You're supposed to handle the tooth only by the crown, like by the tip, and don't touch the root. And then you just gently rinse the tooth with tap water or saline. Don't soak it in the tap water or saline, and don't scrub it. And then they describe that the tooth should generally click back in place, like snapping in a Lego. I've never experienced that. Usually it's got some gentle wiggling and it just gets back in. But if it is truly back in the socket, it tends to be very stable. And, after it's back in, don't manipulate it at all. So it can be actually weeks before you know if the tooth is going to survive or not. But in one study, and again, based on my oral surgery buddies, advice, this is probably optimistic, but there was one study that showed if you got the tooth properly back in within an hour, 66% of teeth had a pretty good chance of surviving. If it was a tooth back in more than 3 hours, then 80% of them died. So I don't know how you square those statistics, but at any rate, 1 hour is kind of the magical number that we're looking to get it back in.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.